Hi everyone.
Hi everyone.
My name is Tanmay. I'm one of the CT1 anaesthetic trainees, and this is a video of a day in the life of an anaesthetic trainee. So the purpose of the video is really to give people a very brief insight into what you actually do day to day. A quick disclaimer about the video is it's being filmed over a period of time, probably about a few months, so I apologise and any changes in appearance. It's approximately actually 3 in the morning and I'm filming this on a night shift because it seems to be the most friendly time to film. So I apologise about how tired I look. We're going to just pretend that this is first thing in the morning. So a bit of information about the training programme. So hopefully all of this stuff should be easily accessible on the Royal College of Anaesthetics website or on the ANRO website, so the Anaesthetic National Recruitment Office. But essentially there's 2 types of training programmes in anaesthetics. There's your core and your ACCS. So I'm currently in the core STEM, and that is a 3-year training programme. You initially start off with your IAC period, so your initial assessment of competencies, and that's a 3 to 6 month period of gaining your airway skills. And then afterwards, you end up doing 6 months total of ITU. For ACCS, it's usually 6 months continuous. If you're in the core stream, you do 3 months in your first year. So I'm just coming to the end of my first 3 months, and then you do another 3 months in your CT3. So we'll probably talk about, I think, general day-to-day theatres, and then we can talk a bit more about on-calls and ITU. So because I'm getting tired of my own voice, I think let's just crack on. So first thing in the morning, I've got changed into my scrubs, and I've got my theatre list of my elective patients that I'm in, and I've also got my anaesthetic chart. So the whole point of sort of doing your pre-assessment and seeing patients on the day of their procedure is making sure that you've got a safe and a very appropriate anaesthetic plan for them, and whether they've had any complications in the past or you anticipate any complications from the patient's point of view. There's most of the procedures that we tend to do are all elective procedures, so they're not emergent procedures. You're choosing and you're opting in to do them, and that's why you want to try and optimize things as much as possible. And if there's something catastrophic, like patients haven't stopped their treatment dose, blood thinning medication or something like that, you shouldn't go ahead. So I'm going to go and assess the patients, and then I will probably see you guys in theatres. So I've got my hat on so I'm not shedding everywhere, and essentially this is the office for the day. So this is the anaesthetic room. We've seen the patients of the morning and come up with some appropriate and sensible anaesthetic plans. And the next part of the morning is to make sure we've got the right equipment, make sure all the equipment and the ventilators are working, making sure we've got the medication ready, and then doing a team brief with everyone involved in theatres, including sort of the scrub team, the surgical team, the anaesthetic team, recovery, and making sure everyone's on the same page. So in terms of the layout of the room, we've got the ventilator there in the corner. Your airway trolley here. This is where all the medications are, and you can't really see the theatres. The main theatres are just through there, and then there's just some more equipment and syringe drivers and things. Yeah, I'm crack on. So this is main theatres, where the operation actually takes place. So usually what we do is we anaesthetise the patient in the anaesthetic room and then bring them over for the operation. That's why it's also important to make sure that this ventilator is working, and I've already checked this and it is working. Once we have our team brief and to make sure we're all on the same page, we'll probably send for our patient. So the first patient on the list was a laparoscopic cholecystectomy, so essentially a keyhole gallbladder being removed. We intubated the patient. They're on the table at the moment, and I've just been sent off for my break. At the end of the operation, we extubate the patient and we take them into recovery, making sure that when they're awake, their pain relief is well managed and they're not feeling too nauseous. We've got another case in the afternoon, so after I grab some lunch, I'm going to go and see the afternoon case for pre-assessment, and then we'll crack on with that. So hopefully that's a pretty straightforward day in the life of video in your elective theatre lists and your general day-to-day when you're not on calls. You can see a wide variety of surgical procedures, from all the way from ENT down to general, gynae, orthopedic, and each one of them you have to make sure that the patient's having the most appropriate anaesthetic for them, whether it's a general, whether it's a regional or a spinal. The next important part of sort of your trainee life is covering intensive care, and as an anaesthetic trainee you'll be covering intensive care for quite a while. So another important part of sort of a day in the life of is the on-calls and the night shifts. So I've got the on-call bleep and I'm currently on a night shift. I'm just sat in a side room of intensive care. In this hospital, our duties include covering intensive care, covering theatres, but we tend not to have a lot of operations overnight, and covering the emergency bleep, so medical, surgical emergencies, cardiac arrest, trauma calls. And in this hospital, it's me and the reg overnight. So we've started our night shift, we've completed the ward round of intensive care, all the patients are stable, we've done the jobs, and we've spoken to the outreach nurse and the medical reg about any patients that they're worried about. Hopefully try and avoid recess if we can this shift, but invariably you'll get some referrals and we'll take things from there. So we've just had a referral from resus about a patient come in septic shock, not responding to medical management, and they think he might need intensive care, so I'm just going to pop down and have a look.
Adult cardiac arrest in resus.
So just got back from the cardiac arrest and resus. Out of hospital cardiac arrest, had quite a prolonged downtime. Unfortunately, we weren't able to get ROSC. We called it as a team after about sort of 60 minutes. There wasn't really a clear cause as to why the patient had arrested. Feeling a bit tired now, so I might just go and have a break. So I thought I'd film this last bit outside of the hospital, not wearing scrubs, just for a change of scenery. And hopefully this video has given you guys a bit of an understanding of what to expect in your first year of anaesthetics and what you'll get up to. So just to sum up, you'll start off with your initial assessment of competencies, working one-to-one, sort of a 8 to 5 type, 9 to 5, Monday to Friday, getting your airway skills. Then you'll join the on-call rota, do your ICU block, which will be 3 to 6 months, depending on if you're a core trainee or an ACCS trainee. And then the rest of the time will be spent doing anaesthetics. I guess a very important point, and the whole crux of this video is really why should you apply for anaesthetics? And I think the things that I've enjoyed the most over the past year have really been the really nice work-life balance. So most of the time, you know, you'll be doing an elective list with healthy people. Everything hopefully should be straightforward, and you know, it's usually a nice stable day. And then on the counter side, when you're doing intensive care and you're doing your own calls, they can be a bit more exciting. So it's really nice to have that balance. I think the physiology and the pharmacology of anaesthetics, and it's quite intellectually stimulating. You do have to think, but also it's also very practical, and there's a lot of procedural skills that you get to do, and that's something that I really enjoy, just being hands-on with those things. And I think the teaching of having one-to-one consultant teaching in theatres, it just makes it feel a lot more like a training program rather than anything else. And I think if you're a person who enjoys those sort of things, then I would say stop watching this video and start organising yourself a taster week, or applying for anaesthetics really. I'll put my email at the end of this video, just in case anyone has any questions or queries or anything they wanted to ask or get more information about regarding the application process or anything. But hopefully this has been somewhat of an enjoyable watch.